In this video, you're going to learn what is going on with your baby, what might be going on with you, and then also I'm going to be sharing how I am feeling because I am currently 35 weeks pregnant with baby number 4. And if you are pregnant, be sure to comment below to let us know how you are feeling because we would love to connect with you on this journey. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4. And before we dive into what to expect during their 35th week of pregnancy, I want to share that my book Training for Two is now available for pre-order. But depending on when you're watching this, it may be available now. It comes out on September 10th of 2024. And it's all about how you can use prenatal fitness to have a strong pregnancy, a pain-free pregnancy, while also helping you to prepare for birth. There's even a whole chapter about recovery in the postpartum.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3. And I'll be going over all of the what to expect with your baby and you during your pregnancy.
So Roxanne, what is going on with baby during week 35? They're almost done cooking.
They are almost done cooking at week 35, like pretty much there. If baby was born at this exact moment, they likely would be fine. But there are still things that are developing after the 35th week. So like baby can still needs to cook for a little bit longer. Week 35, baby is the size of a George Foreman grill, if you remember what those were. I think that's the grill that Michael Scott steps on in The Office and burns his foot. That's the only thing I remember. I never owned one. But if that one doesn't resonate with you, the size of a pineapple, which hopefully you're not eating just like so many that you're just like ruining your mouth.
Sore lips and stuff.
From just the acid of the pineapple. But baby is the size of that
right now. But Roxanne, I'm trying to induce my labor.
Oh, it does not. It's not evidence-based. Don't only eat pineapple if you like pineapples.
In moderation, because also pineapples can give you diarrhea.
Yes, very true. All fruit, really. The acid. But in the week 35, baby is pretty much fully developed, like we said, except for their lungs are still developing, but their kidneys and livers have now fully developed, so they are now producing lots of waste. So baby has been peeing since week 13 of gestation, but baby is continuing to pee and is now starting to create poop that is starting to fill their little bowels. This poop is called meconium. So this is that sticky, tarry, really dark green, almost black in color poop. That's like the first poop. Sometimes it comes out while they're still in the womb, but most babies it comes out after the womb. And it's so sticky, it's sometimes really hard to get off of that butt when they have that first poop. So my trick is normally to put some sort of like petroleum jelly or some like lubricant on their butt before they poop because it makes it a lot easier to get it off of their skin afterwards. Some parents will like sit there for hours just like wiping that butt to get this meconium off.
It's like the Sharpie poop.
Yeah,
just every wipe.
Sometimes it's really hard to get off. Just leave it there and come back for the next poop.
I had someone recommend using olive oil to put that on baby's butt, and that makes it easier to wipe off. I personally haven't had issues with it, but I also am not the diaper changer. My husband is. So maybe I just didn't know. And he's been struggling in silence.
Yeah. Both my 2 girls had meconium before they were born. So we didn't have that issue with their first poop being like super, super sticky because it was starting to transition. And my son pooped on me at birth. So I didn't really have that issue either.
How beautiful.
It was on me instead. At this point, week 35, baby's movements are starting to change potentially because baby is almost at the size that they're going to be at delivery. Their growth has started to slow down at week 35, where they're not going to necessarily get a ton longer, maybe an inch or so longer, but they're going to still be packing on some pounds just for like chub and like some of those rolls. But they're likely not going to gain like a substantial amount of weight between now and birth. But the reason that these kick counts might be changing is because they're running out of room within the womb. So they don't have as much room to like wind up their hand and punch. So your kick counts should still be the same amount of movements. They might just feel differently. They may not be those really pronounced kicks and punches. I might be more of like a roll, a subtle roll, or like they almost like kind of take their elbow and like rub it along the inside of your body, which does not feel great, but they're just different types of movements, but they should still be moving about the same.
That's like a big myth that I'll hear is like, oh, since you're so close to your due date, your baby's not going to move as much because they're running out of room. But they should still be moving the same frequency. It's just going to feel a little different than it did when you were like 20 weeks or 28 weeks because they're just a lot bigger now. So that makes a lot of sense to me. And I really get very frustrated when I see people make statements like, oh, they've run out of room. That's why they don't move as much, because how baby is moving could be your only indicator that there's an issue going on too. And so I know that's something that is very stressful for some folks is like, I didn't really feel my baby moving that much today, or they weren't moving at their usual times. I'm a big advocate for
go in.
Just go in and see what's going on. Rather like go in and get that reassurance that they're fine as opposed to stay home. Because again, how baby is moving can be our only indicator of whether or not they're feeling okay. And nobody at your birth location should give you any heartburn over coming in and getting checked if you're concerned. And if you do, that's really unfortunate, and they probably should consider a different career field, I think.
Yeah. Yes. Last thing about week 35 is I said it for week 34, but again, the amniotic fluid starts to reach its max amount between 34 to 36 weeks during pregnancy. This is where the amniotic fluid, again, is at its highest. And then after that, it starts to slowly decrease over the weeks as you get closer and closer to 40, 41, 42 weeks. So just know that now is the time that your amniotic fluid volume is at its peak. And if it does go lower, if you have an ultrasound between now and next week, if it goes lower, that is completely normal. And it's a normal process that happens just naturally. So for you, your normal pregnancy symptoms that you likely have been experiencing will continue most likely, unless you have found the treatment of your specific ailment. But some things might develop as baby is now larger, and one thing that's really common is heartburn. So if you haven't been experiencing heartburn, it's very common to start to feel it in the later third trimester. And this is for different reasons. Number one, progesterone. Progesterone is causing changes within your body like your entire pregnancy, but one of them being is progesterone causes relaxation, especially of the sphincter that connects the esophagus and the stomach, to allow stomach acid to come more easily through than it normally would outside of pregnancy. Also, your gastric system is moving food through the gastric system slower, so food is like sitting in your stomach for longer periods of time, which just brings the acid closer to the bottom of that esophagus to allow it to come and affect your esophagus. Common symptoms that people complain of with heartburn is that they feel this like burning sensation, or sometimes we'll even say like chest pain when they're having that heartburn type pain, burning in like the back throat area, especially when they're burping, they'll have this like very burny type of burp. Or what I felt when I had heartburn was just a lot of pressure in my chest, and it was very uncomfortable and almost like crampy in this area where the esophagus and the stomach connect, surprisingly. Another reason that this is happening is that as your baby gets larger, your baby is putting more pressure on the bottom part of your like diaphragm and your stomach and making your stomach less big. It's decreasing the amount of space available within your stomach for food. So this might be leading you to being fuller quicker when you're eating meals. So you find that you maybe aren't able to eat as big of meals as you were before, but then you're hungry a couple like hours later. So you're eating smaller, more frequent meals due to your stomach being smaller. But also this is actually beneficial for the heartburn because smaller, more frequent meals actually decreases the amount of food that's just sitting in the stomach causing the heartburn.
Something else that could be contributing towards heartburn is our diaphragm position changes as we get more pregnant, especially if you begin to favor this very extended position, so more of like a rib flare. So ribs are kind of angling upwards. This is bringing our diaphragm into a different position, and it can't quite work as well. And so some things that you can do to help resolve heartburn, like because some folks are looking for exercises to try, is anything that helps you kind of bring that rib cage down to kind of reorient that diaphragm over the pelvic floor. And you can do this either with core exercises that help kind of pull the abdominals so that the rib cage and pelvis move a little bit closer together, in addition to back expansion exercises. So finding more of like a rounded position in your back and breathing into that space can also help to release tension in the backside that might be pulling you into this arch position, because our diaphragm, the contraction of the diaphragm is what is really helping that sphincter between the esophagus and your stomach contract so that the acid doesn't come up. So sometimes just changing the position can help relieve symptoms too.
Other things you can do other than those exercises, which I do highly recommend, are you can try antacids. I will say Tums is not the best option. A lot of people be like, oh, I'm just popping Tums all throughout my pregnancy. And it's not the most effective antacid against heartburn because it'll give you like kind of instant relief, but it's not lasting. And it's almost like the rebound heartburn after the Tums have worn off are worse. The types of antacids that may work better during pregnancy are Mylanta and Maalox because they just work differently than Tums. Some people really, really say papaya enzymes really help with heartburn. I did not try it personally, but a lot of people rave about papaya enzymes, whether just eating a papaya or like taking like the papaya extract can be really helpful for heartburn. Eating apples, like 1 apple a day, keeps the heartburn away. And then the old tale of milk, like the milk is helping to decrease that burning sensation, neutralize the acids within our stomach, can also help. That one, again, it's not a long-term solution. It's more like an immediate relief and then it's going to come back. So find another option until that one comes back. And then sit upright for at least 30 minutes after eating. Do not lay down immediately after eating. That was my downfall during pregnancy. We would eat dinner late and then I would go straight to bed and I would wake up with horrible heartburn like at 2 a.m. Don't recommend. I made the mistake not once, not twice, 3 times. Learn from me. Don't eat and immediately lay down. I would say almost stay upright for at least an hour before going to bed. And another thing that some people will start to experience during pregnancy is vision changes. And so like if you had like 20/20 vision, you might start to notice that like your vision is just like not as crisp during pregnancy due to the hormonal changes. This usually will resolve after pregnancy, but if you had like glasses during pregnancy, this is why the doctors don't recommend going to see them during pregnancy and getting your prescription changed. So you can still see the eye doctor when you're pregnant, but they don't recommend getting all new prescription wear during pregnancy because once you're no longer pregnant and potentially even no longer breastfeeding, your vision can like return back to normal. And then you then have to go buy new prescription glasses again. And glasses are not cheap. The reasons that though with vision changes, that would be a reason to call your provider is if it's like blurry vision where like you can't see anything, any loss of vision, dots in your vision, like little black spots, or even like where the sides peripheral vision is now gone and it seems almost like the walls are caving in, any like huge vision change, this could be a sign of something called preeclampsia, so high blood pressure that is now affecting our bodily function. And that is definitely a reason to definitely go in, be seen, be assessed to make sure that nothing is going on. But that's really kind of like the top points of 35 weeks pregnant to you. How are you doing though, Gina? Aside from the heartburn.
I actually haven't had heartburn this pregnancy.
Oh.
I had it last pregnancy though, and my midwife recommended dried papaya. So we sliced up our own and dried it on our little
look at you.
dryer. But I didn't really eat them that much. And so I just suffered through heartburn. But being upright and sleeping more reclined was like really helpful for me with managing it. But we actually just got back from a weekend trip. So we went out to Kentucky where my husband is from. I did like a news interview and then we spent some time on the lake. And I was exhausted after being outside for a period of time. So I then took a 3-hour nap afterwards. But I was a little bit concerned that my SI joint pain was going to act up because I essentially didn't work out for like 3 or 4 days during this mini vacation. And we were also in a car for like 8 hours, but it didn't, surprisingly. I was very, very pleased that I didn't act up on me. I was wearing like really supportive leggings from Balbay the whole time. So like the belly band leggings. And so I think that really helped a lot. I was also like just taking it really easy during the trip, like really focusing on hydration. But really excited to get home where all my pregnancy pillows and cooling blanket and all my props are located because I'm in my comfort phase right now of pregnancy. I was dealing with more insomnia in the previous weeks, but this past week I've been able to fall asleep really easily or I've been able to sleep in. So I've still been getting my like sleep amount. My little Whoop watch told me that I am now debt-free in sleep.
Oh, your sleep bank is built back up.
Sleep bank is full, finally. Because the Whoop Watch was saying that 7 weeks before you go into labor, your heart rate variability is supposed to begin to increase again. And mine was increasing, but then I had all that insomnia, so it went back down. And so now I'm like, I don't know when I'm going to go into labor. Who knows? Or I'm just going to be pregnant forever. Who knows? Because I'm kind of at the point where like baby could come in 2 weeks, not very likely, or baby can come in like 7 weeks. So, you know.
We'll
It's a really
see.
big window.
Time will tell.
It's a really big window, but we have kind of started finalizing the birth preparation. So we have most of the stuff that we need for birth. We're going to blow up the birth pool this week to make sure there's no holes in it, that it's clean, if there's like any last minute things we need to do to repair it or potentially order a new one so we have time. We have all our home birth supplies. I have my labor box all set, so it has all my like labor comfort tools and stuff that I'm wanting. There's like a few odds and ends that I'm still going to add. And then we pretty much have everything ready for baby. The car seat came in, and then we have plenty of clothes, and I have a baby carrier, and
I have more clothes for you.
that's kind of it, I think. So we're pretty much set for the postpartum mostly, which is nice. I like to have all that stuff done by week 37. Not that the baby's going to come that week, but it just allows me to just kind of rest and just chill for the last few weeks before the baby comes, just kind of hang out with the kids. And I'm also starting to taper down with my work here at Mama's Day as well, where we're almost done with all the videos that we need to film and just kind of finishing up these last minute projects before baby comes so we can just focus on her, and which is, we're near the end. It's pretty wild. This has gone really, really fast. Yeah. So that's really it. Feeling overall like physically really good. This is the best I've felt out of all 4 pregnancies. In the evenings, obviously, I'm just uncomfortable and pregnant and a little grumpy. Pregnancy insomnia seems to be resolving for this week. We'll see what it looks like next week. Maybe it comes back. It seems to be very cyclic. Baby girl is moving a whole ton. We've had appointments with our home birth midwife. We have an appointment upcoming with our hospital midwife as well to do the GBS swab. I'll probably get my iron levels checked again to see if I'm still borderline anemic or not. Hopefully I'm not, because I do feel like I have more energy and I'm not as anxious anymore. So ideally that means my iron levels are better. But yeah. So if you are pregnant, be sure to let us know how you are doing in the comments below. I've luckily don't really have a ton of complaints this week, other than we took our last minute trip that we were planning for the summer, and now it's just kind of time to focus on meeting our baby. Let us know in the comments below what you are doing to kind of finalize your preparation for your baby as well. Because you're probably near the end of your pregnancy, you might be wondering, is it too late for me to do anything? There's still lots of options that we offer to support you even in this final month of your pregnancy. We'll link our 3rd trimester specific options down in the notes below, and you can explore to see what option feels best for you. And as a thank you for watching this video, be sure to use code YouTube10 to get 10% off any of our online offerings. And you can even apply them to postpartum programs as well if you're like, well, pregnancy's pretty much done. Let me start thinking about the postpartum. We do have postpartum education courses and fitness programs as well.